Hello everyone. So now in this video we'll be discussing on the radiation treatment of the breast cancer. So breast cancer is the cancer which basically develops in the female populations and is very most common cancer among the female population. Okay, so breast cancer radiation therapy uses high energy x-rays. So you know that x-rays are used to kill the cancer cells. So cancer cells are the cells which used to divide very fast actually. Okay, and x-rays are the particles which are painless and invisible. Okay, so x-rays are the particle which are painless, means if we use x-ray to kill any cell they will cause no pain. Okay, so they are painless. Now what are the types of the radiation therapy we use actually external radiations and internal radiation to kill the cancer cells in the case of breast cancer. So it delivers radiation from outside to the chest. So from outside we give actually the radiation in the chest, and most common type it is used for the breast cancer. Okay, and internal radiation is actually also called as brachytherapy, and after operation it is actually done after the operation. Doctor will perform a temporary place a device to deliver a radiation to the mammary gland in the area where tumor was. So if the operation has done, means surgically the part of the cancer has been removed, so after that doctor places a device which will deliver radiation inside the mammary gland to kill the remaining cells. Now radiation therapy is used to treat breast cancer at any stage. So radiation therapy is the main treatment which we can use at any stage of the cancer. And what is the effective way to reduce risk of breast cancer is after surgery. Okay, so the radiation therapy is the effective way to reduce the risk of breast cancer after surgery. Irradiation after organ preserving surgery. So the second task is this: have surgery to remove the breast cancer while preserving the remaining breast tissue. So the meaning is that we will do the surgery, remove the breast cancer, but we will preserve the breast tissue, and after that doctor may do the radiation therapy. So that is called as irradiation after organ preserving surgery. So this is another method. Now organ preserving treatment in combination with radiation exposure is actually called as breast preservation therapy. So basically it is called as. Okay, now you can see in this image actually, this is external beam radiation. High intensity X-ray beam is used several angles. So this is actually the external which we discussed. External radiation. This is the brachytherapy which I told you. Internal radiation which is called as. So in this we used to place a device that is called as catheter in the breast, and through which we actually inject the radiation. And third one is the proton beam, which directly affects your tumor. Okay, proton beam therapy. This is the third one. Now after oncoplastic surgery, we do the irradiation of entire breast, irradiation of part of the breast at early stages of cancer. So early stages of treatment we actually use the part of breast, otherwise we used to do the full entire breast. And what is the radiation after mastectomy? After the removal of breast, what we do radiation therapy to reduce the risk of cancer recurrence. Now we have three conditions which we use the radiation after mastectomy. So lymph node with sign of breast cancer, large tumors more than 5 centimeter, and signs of oncological damage to the edges of tissue. So if we have the cancer in the breast and if there is damage to the edges of tissues, we actually use the radiation therapy for that. Now radiation therapy for locally advanced breast cancer used when the cancer cannot be surgically removed. So it is small cancer or somewhat inflammatory areas, like inflammatory aggressive type of cancer that has been spread to the lymphatic collectors. So in that case we used for the locally advanced breast cancer. And this type of cancer is treated with chemotherapy before mastectomy. So first we give chemotherapy before doing the mastectomy, or we can do radiation therapy to reduce the risk of recurrence. Now what are the side effects of breast cancer? Most common side effect is moderate to fatigue, skin irritation, itching, redness, peeling and blistering, swelling of the breast, swelling of the hand, that is called as lymphedema, and damage or complication due to the removal of implant. Now the preparation for radiation therapy session, what doctors are used, like oncologists, consultant are used, radiologists are involved, nurse of radiation of onco department, radiation therapist, dosimetrist, which will tell which will tell the doses of the radiation, what amount of doses should be given according to the size of the tumor. And before external radiation is done, what do we do? Radiotherapist will help to take the best position to target affected areas by using pads or other devices. Okay, and In this diagram also you can see the similar view, like this is external beam radiation, this is brachytherapy, and this is the proton beam therapy. Okay, so in external radiation we use CT to diagnose the area of normal, to differentiate between normal and affected tissue, and we used to mark it by semi-permanent ink marker to carry out the radiation, where we have to exactly give the radiation. And dosimeters is also involved to plan the doses, how much doses to be given to kill that tumor. Now what is the course of the treatment? So course is started 3 to weeks after the surgery. Okay, radiation therapy after oncological surgery is done after 3 to 8 weeks unless chemotherapy is planned, and 3 to 4 weeks after the end of the chemo or radiation is performed. So after chemo we used to give radiation therapy after 3 to 4 weeks. After surgery we used to give 3 to 8 weeks, and 5 days a week for 5 to 6 weeks a week we used to give this radiation therapy. So 5 days in a week for 5 to 6 weeks. So this is actually the radiation treatment for the breast cancer, the basic overview. Thank you.